Recording. Okay. My phone made an oopsie. Okay. Seatbelts. Do we know why seatbelts are important?
So you don't get.
They save your life.
They
You don't
do save
get
your life.
tossed out of the car.
Yes. The probability of you dying goes way higher if you're not wearing your seatbelt. But
It's
sometimes,
way higher if you're not in the car.
or that, sometimes if you get in a really bad car accident, lot of energy in the car accident, you can get seatbelt marks.
Yeah.
Seatbelt marks across your stomach, which could also be bad. Do you know what happens if you have if a seatbelt cinches real tight and causes bruising? Do you know what it can affect?
And all your organs or whatever.
Yes, good job.
So make sure your seatbelt's laying in your lap instead of your stomach.
Your spleen.
Yes.
Yeah.
Your spleen, your stomach.
Splenectomy.
That is okay.
Blow your dead stomach out.
Yes. Ew. Okay. Sometimes, like coup contra coup, like I was talking about, the force of going forward and then back, when your seatbelt is across, what's in here?
Your heart and your lungs.
Good job. And sometimes if you're not wearing your seatbelt and you hit the steering wheel really hard or you have other impact, it can cause hemothoraxes, pneumothoraxes. Do we know what those are?
No.
It's a lung that pops.
Ew.
Yes.
Deflate it.
You have to deflate it with a needle. It's called needle decompression, which I cannot do. Paramedics do. It's really cool to see. But sometimes if you have a hemopneumo and you dart them, that's what it's called, is darting. You use 10 gauge needle into like the fourth intercostal space or second something. If you have a hemopneumo, blood will squirt out. But if you have...
That's a hematoma.
Hematoma is a bruise.
Yeah, but isn't that blood?
Blood under the skin. I'm saying hemopneumo. Blood, pneumo, lungs.
Hema though. Blood.
Hema, blood. Yes.
Yeah.
Yes. Good job.
Whoop, whoop.
When you have a hemopneumo, if you dart it, blood might squirt out. If you have a normal pneumothorax and you dart it, you might hear it go psst.
That's good.
Yes, that is good. That's a good sign that you got it. You fixed it and whatnot. Okay. It's a collapsed lung. That's the best way to explain it. Okay. Do we know why blunt or penetrating trauma to the neck can be very bad?
Yeah.
Because you got your...
You can bleed out. Bleed your waist box.
Airway, your main arteries.
Yes, your airway is the most important thing. So in EMS, we go through ABCs. Airway, breathing, circulation. Then for trauma, there's XABCs. XABCs. X is control the bleeding. So say there's no bleeding and we got compromised airway, ABCs, you go airway first. Airway for pretty much everything, even in medical. Make sure they have a patent airway. If they're talking to you, their airway's patent. So going with car crashes, what's another dangerous type of crash?
Rollover.
But not involving a car.
Train crash.
That would be... Yes, motorcycle crashes. Why are they so dangerous?
Because there's no safety features on them.
Yes. Pretty much just a body on a... Rocket, yes. You don't have airbags. You don't have... Some people don't wear gear, and clothing rips very, very easy.
Burns into your skin.
Yes, and if you're not wearing a helmet, very bad. Motorcycles can go very fast. There is nothing to help the collision in those cases. Nowadays, sometimes they have backpacks that have built-in airbag.
And
Those
same
are-
way they were trying to come up with something like that to where it sees a force trauma or whatever and it sets it off.
Yes, those are very cool. Very cool. Back to neck trauma. How would you know if their airway is compromised?
If they're not breathing.
You can be breathing. Yes.
They're gurgling.
Yes, so that's called
Kinda
noisy.
holding it.
Yes, noisy or labored respirations. That indicates that you have an airway problem. Do you know what can happen? So we went over chest trauma and abdomen. What about your head? Say you're on a motorcycle crash, high velocity, not wearing a helmet. What do you think can happen inside the brain?
Mushy.
Instant swelling.
Yes, yes.
Scrambled
Or
eggs.
brain bleeding or
Yes, brain bleeds. We also can see spinal cord injuries, especially in like the neck or the head. Intracranial hemorrhaging. Very blunt force to the head. Some symptoms can cause headache, nausea, vomiting, difficulty moving the extremities, especially if you have a spinal cord injury, loss of consciousness. Whenever we go on any car wreck or any fall, for me, my questions that are in line are they on blood thinners? So if you're on blood thinners, all your blood is very water.
it's dead.
It's very thin, watery. You're more likely to lose blood, and you have like intracranial hemorrhage or so many things. But I always ask them if they're on blood thinners, if they had a loss of consciousness. A loss of consciousness can tell us how bad their head could be, how hard they hit, how much impact was involved, and then their mental status, which is called A&O questions. So if you're A&O times 4, you're with it. Your head is okay. A&O times 3, A&O times 2, A&O times 1, A&O times 0, most of the time you're unresponsive. So, yes. Okay. Crashes. Okay, penetrating trauma. What is penetrating trauma?
Stabs.
Yes.
Whether it's a knife or a piece of rebar or
Yes. It could be a tree, you could be on a bike and be driving real fast on like a dirt bike in the mountains and a tree branch could go into you.
Yeah.
Or it could be gunshot wounds. Gunshot wounds are also penetrating trauma. So say that you get stabbed with a knife. What's the first thing you do?
you pull it out.
No.
Well, no, that's typically what they do is pull it out.
You do
No,
not
you
pull
leave
it.
it in.
Yes, we leave it in. Even EMS, we leave it in. We will pack around the wound and try to stabilize it, whether that's with tape or we have these fancy things. I always picture using what we stabilize a tube with to keep the tube in their mouth, like wrapping that around the wound and around their back to stabilize it so it doesn't move. Because that's not our job. That's surgical unit's job. Because once you pull it out, it could be an artery that you don't know. And sometimes if that knife or whatever weapon or object or anything is in there,
Keeping it sealed.
it's keeping it sealed, yes. So we don't want to pull it out. That could be lethal for the patient. When we have a gunshot wound, we have an entrance wound and an exit wound. It's always good to find both of those.
What if you don't have an exit wound?
Then you have high probability for what has happened. So gunshot wounds, if they are shot in the head, but they have an entrance wound but no exit wound, sometimes you can assume that it was a certain type of bullet. Like, what are the hollow points? Hollow points will explode. Sometimes they won't leave an exit wound. So it's good to know what kind of gun was used because then it can give you all of what you should be prepping for.
I'll tell you if it's still in there somewhere or not.
Yes.
I've heard stories where somebody will get shot in the leg and it'll come out higher
Yes,
Yeah,
yes.
you get shot with a 22 from far away and it can bounce around your whole body.
Exactly. Good job.
There's some of them that they're designed to come apart and they'll travel anywhere and everywhere.
Okay. The path the projectile takes in a gunshot wound is referred to as trajectory. Fragmentation was what I was saying, like fragments can be left in the skin, which is always good to tell the ER if you're bringing that in. If you do see what type of gun it is on scene, most of the time I wouldn't know what type of gun it was, but on most scenes that involve a gun, you're gonna have PD, and PD should know what type of gun that was, and that way you have better ideas to take care of your patient. Blast injuries. Do we know what blast injuries are?
Explosions?
Good job. Good job. What do you think injures a person the most from a blast injury?
It's the percussion.
Yes. Good job, Father. Do you know why that is?
Because it's the energy.
I'm just thinking, yeah, it's the shockwave more than
Yes,
anything.
the shockwave, the energy. It can send so many other objects towards you, and there's also so much heat. So with blast injuries, we have to look for if there's objects in them, because it can throw objects in them. Flash burns, which are part of the primary injury in blast injuries. Toxic inhalation, if they inhaled anything that was poisonous from that blast injury, like chemical plants, you don't want to inhale that stuff. Always looking at their airway to see if it's burned, if it's charred. Yes.
Yeah, because you'd have different styles. Like you can have a steam vessel blow up, or you can have a coal blast or something like that.
Yes.
Your coal dust is extremely flammable.
Yes. If we have a chemical blast injury, the first thing that us as EMS responders want to do is decontaminate that person first, so we don't contaminate ourselves, and then we don't contaminate our ambulance, and then when we bring them to the ER, we don't contaminate the ER. Spreads like wildfire. Don't want that. Okay.
The Chernobyl series we just watched.
Exactly.
Nobody understood or knew what was actually going on.
Yes. When it comes to pre-hospital and trauma care, trauma can mean so many different types of calls. So protecting ourselves is the most important part. Managing those life threats that people have, controlling hemorrhages, controlling the airway, such and such. You're more likely. Do you know how long it takes for a person to bleed out entirely from an artery? Under 5 minutes.
I was gonna say 3 minutes.
Yes. So getting those hemorrhages controlled is very important. Do you know how long the human body can live without air? Typically, in a normal person who isn't a deep sea diver or an Olympic swimmer,
5.
6
6
minutes. 6 to 7 minutes we can live without air.
Where are you going, Poppy?
Now is that just without air, or is that zero circulation where you don't have any air or oxygen going to the brain?
Without air, if you're not breathing, you're not perfusing, you're not getting air to your brain. So.
But if you may not be breathing or whatever, but if your heart's still pumping, it's still circulating some though, correct?
Yes, it's still circulating blood, but for blood to be, you have to have oxygen in your blood to perfuse it to your brain. So your heart can still be pumping, but if you're not breathing, you're not perfusing.
Oh, what's that?
But it's swip swappy too.
Yeah,
If
so
you're
you're just circulating, what is it, carbon dioxide or whatever?
sometimes, yes. Okay. went over that. Say that we weren't in Casper, Wyoming with the only hospital. Say we're in Denver and we want to transport a trauma patient, which in Casper we only have one hospital. And same with, well, I mean, here in
Almost
Glenrock,
everywhere. It's
yeah,
just the one.
here in Glenrock, if they're gonna pick up a trauma patient, it's gonna go to Casper. It's not gonna go to Douglas. Douglas is a trauma 3, trauma 4 center. Casper is a trauma 2. So say we're in Denver and you have a trauma 1 level patient. You're gonna want to try to take them to the highest trauma center that you can. Same with like cardiology. So they have certain hospitals in Denver that are perfect for cardiology. So you have somebody having a heart attack, you want to take them to the cardiology center. Or if you have a baby that has been injured or medically ill or anything in any type of way, you want to take them to the Denver Children's Hospital.
Well, the paramedics, they probably know all that, which ones to go to. Don't they?
Yeah, the paramedics in Denver probably do. What else is there? There's so much to trauma. Do we know what a good blood pressure is? Historically in books.
120 over 80.
Yes. Do we know what a good heart rate is?
96.
80 to 100.
I was gonna say like 80.
Yeah, 80 to 100.
I got both of those wrong.
What about respiratory rate?
96.
96?
Respiratory rate, like how many breaths you're taking, or your,
Yes.
Oh, not your O2 stats.
I'm guessing probably 30. In a minute.
60.
12 to 16. That's how many times we breathe in a minute.
That'd be normal.
Yes, that's normal. Babies, everything's going to be much higher, other than their blood pressure. Their blood pressure is going to normally be lower, but respiratory rate's going to be higher. Oxygen stats are going to be higher. Pulse rate is going to be way higher. Like newborn babies, like 160s. Good. And yes, Mom, you're right about O2 saturation. 96 is pretty good. 94 to 98 is good for an adult. Really, 90 and above is good for an adult. Okay. What else is there?
So what's considered high blood pressure?
So like stroke level high, where we're scared you're gonna have a stroke, is 200s over 100s. When your diastolic is meeting what your systolic should be. Systolic is top number, diastolic is bottom. So even like 190 over 90 is high, 180 over 90 is high. But when we're worried about high blood pressure, we're worried about your systolic number. So if it's in the 200s, and if your diastolic is in the 100s, that's not good. And then you have low blood pressure. Anything below 90 is not good. You're not perfusing, you're not pumping enough blood to your organs, your kidneys are not perfusing at that point. So 80, I think it's...
So if your bottom number is like 100 or 110, and your top number is say 150.
Not good, that's high blood pressure.
But why?
Why is it high? Why is your blood pressure high?
Well, I guess, I don't know. So why would it be high at one point and then maybe normal at a different point?
There's
On a
lots
regular
of
basis.
things that can
Yeah.
cause high
So,
blood
like,
pressure.
I would assume, for me, my blood pressure gets really high on those critical calls.
Right.
Because I'm so amped up. Or say Mom was sick right now with pneumonia or the flu or something, her blood pressure is probably going to be high. And she's also probably not going to be drinking enough fluids and be dehydrated because she's been pooping and puking a lot, and then her electrolytes are off, which can cause your blood pressure to be high. It can. So yeah, every
There's
person.
lots of reasons that can cause
Yes.
your blood pressure to be high one time and normal the next.
Yes.
So is it bad when it does that, when it fluctuates so much? So if you say,
It
like,
could
at
be.
the end of the day, when I go see my doctor and I've got like a 140 or 150 over 90 or whatever, but then I can come home or check check it first thing in the morning and I'm 120 over 80.
Yeah,
Ish.
it can always fluctuate. If you're constantly hypertensive, if your blood pressure is constantly high, you need to be on some blood pressure medications, which are beta blockers, so metoprolol, propranolol. I don't know if propranolol is one. Lisinopril. Those are all hyper blood pressure medications, which can help. But you're also a little overweight, and you're old.
Not that old. Good
Mm.
lord.
You're a little old, man. Your blood pressure's up. You're in. Mom's gonna start getting it. You're old. You got no teeth now.
Does that matter with my blood pressure?
No.
Oh, okay.
But you guys are gonna start getting the old people stuff. High
When
blood
does-
pressure.
When does Dad start getting old people stuff? I'm older than him.
Have you not seen all the gray hair?
Dad's also very medically wrong. You got
I won't argue with you there.
you got an ileostomy at how old?
26?
Yes. We do not see very many 26-year-olds walking around here with ileostomies. Or Crohn's disease.
We don't see
Or-
a whole lot of 21-year-olds with POTS, do we?
Yes, we
Oh,
do.
you do?
All the time.
Oh,
Now.
why?
So many
I'm sure
reasons.
that's a lot of my problem is not having my large intestine anymore and I'm not absorbing anything.
Cassia,
Dehydrating and
Okay.
Cassia, why do so many of you young people have POTS?
I don't know. So many reasons. They don't know. But back to trauma.
sidetrack.
Okay.
Aiden, would you make your mother a spot of tea?
Yes, mother.
The sleepy tea, please. The blue one.
Yes,
Do we know what... I feel like you would know, Mother.
I know.
Do we know what hemophiliacs are?
Yes.
Yes.
What are they, honey?
Hemophiliacs.
Yeah.
Trying to think, they're ones that it's either internal bleeding or where they won't stop bleeding
It's
because of
clot.
their. Oh, okay, so
They can't. They don't clot.
yeah, and
Yeah,
a lot
so-
of that's because
So it's one. Hemophiliacs don't clot. They don't just randomly start bleeding in their stomach.
But
well,
it's
no,
not if they
I
have
knew it
internal
had to be
bleeding,
come
it's-
from something causing it to bleed or
yes.
whatever, but I
It
just
could
can
be a
remember.
paper
If,
cut.
yeah, I just can remember if it was internal or if it was any bleeding.
Any bleeding.
Yeah.
But yeah, internal could be worse.
Yeah.
Yes. So hemophiliacs, they don't have clotting factors.
Is that vitamin K?
My mom and dad asked me so many questions. I don't know. I don't know.
Is it natural? Like to be well, I know like not natural, but to be hemophiliac, or is it say from blood pressure medications
No,
or something like that?
hemophiliacs are born that way.
Yeah, they're born that way.
Yeah, and
Um,
it's only men.
It is not only men.
Doesn't say I didn't think so.
It is not only men, no.
I
Women
thought-
can also be
Oh, I
hemophiliacs.
thought women could be carriers, like their male children could have hemophilia, but I thought only males could.
No, male and females could have hemophilia.
Well, that's not a known fact for people my age and older,
Yeah.
because back when I was in school and stuff, learning like it was only men.
I'm pretty sure I've had women who are.
And they always thought,
I was gonna say so.
back in the day, they thought that it was caused from a lot of inbreeding.
Yes, women can have hemophilia. It's much more rare in women. And it usually happens, it can happen from, it's pre-puberty, so 10 and younger. Sometimes you won't be, yes, you can be born with it, but sometimes it won't pop up until you're 3 or 4 or 5 or 6. That's the same,
But
like,
then you have it forever, right?
yes.
Yeah.
Yes, you don't have clotting factors. So, say we have a hemophiliac and they slipped on the floor on some ice. Worried? Not worried.
Always
Worried.
worried.
Very worried. Very worried. Very small mechanical falls, even like you've heard when they get bloody noses, it just doesn't stop.
Mm-hmm.
So when they
Off
have
the
the,
counter,
yeah.
Stub
So
your
we-
toe.
we have a high likelihood of them having a bigger injury than that we can't see, and I've seen it to where you could touch a patient who's hemophiliac and they're bruised already.
Mm-hmm.
Put seatbelts on too tight, they're going to be bruised. So always being cautious of those type of patients. And they should be transported immediately. They are a priority patient at that point because they could be bleeding so much and we have no idea. Okay. What's another thing? Okay. Let's go to trauma triad of death, which is hypothermia, coagulopathy, acidosis. It increases the mortality of trauma patients dying. They can rapidly worsen. Hypothermia, do we know why that is bad in trauma?
Well, yeah, because your body temperature drops or whatever, but you have the sensation of being warm. So then if you warm them too quickly, you can put their body into shock.
Yes. Not what I was looking for, but yes. Very right. They're not clotting. Their blood they're not warm enough to clot. So, and they're not warm enough to perfuse. So, say you get shot out in the snow, your likelihood of dying is very high because you're already cold. You're not dead until you're warm and dead. And if you're cold and dead, not a good sign. Okay. So hypoperfusion, which is when we're not perfusing our blood, our heart is not pumping to our brain, we're not getting circulation. It can cause cells to use anaerobic metabolism, releasing additional acidic compounds into the blood. This creates acidosis.
What's acidosis?
Acidosis is reducing oxygen delivery and body metabolism, increasing in hypothermia. Yes, acidosis is, trying to think of, if you're breathing really fast, so like COPD patients, DKA patients, they're very acidotic, so they're trying to breathe off all of that acidosis to achieve alkalosis. It's a whole thing.
Wow.
Anyways.
What's amyloidosis?
What?
What's amyloidosis?
Man, let me look it up. Amyloidosis?
Yeah. Amyloidosis.
Amyloidosis is a rare serious disease occurring when abnormal amyloid proteins build up in the organs, tissues, most commonly in the heart, kidneys, or liver, and the nervous system, causing them to malfunction. Symptoms include edema, fatigue, shortness of breath, and numbness.
What about amyloid plaques in the brain? How do those happen?
I have no idea.
Oh my.
I have that.
No, thank you.
Can you make me coffee?
No, it's too late for coffee.
It is not. Thank you.
Not when she works night shifts.
Okay.
Like half a pot?
I was gonna say, I made some this morning. There's not any left from this morning?
Not usually, like 2 scoops. I can check if there is still holdings.
Okay, I'm going to give you guys scenarios, and you're going to tell me high mechanism of injury, low mechanism of injury. What's high mechanism of injury again? What does that mean?
Like car crashes at a high rate of speed or something?
Yes, that's a
Or
high
fall.
Yes, that's a fall from.
20 feet.
Yes,
Matter.
high mechanism. If it's a fall, if it's you that fell on the floor just now from where you're sitting, low mechanism of injury.
But you can still die.
Oh my god.
You could. So I'm gonna give you.
Yeah, right.
I'm gonna give you scenarios, and you're gonna tell me if it's high or low. You fell from a ladder, and the ladder fell on your head. High. Good job. Okay. You fell on the floor with your arm outstretched.
Okay.
Low. Good job. You're an unrestrained driver, which means you're not wearing your seatbelt in a head-on collision.
High.
Yes.
You're probably dead.
You are a restrained driver in a head-on collision.
High.
Still high.
Yes, good job. Okay. You are an unrestrained driver and you hit a stop sign going at 2 miles an hour.
Low.
Low.
Aiden,
Yeah.
will you go check on those kids? I think I hear them outside, and Molly has no shoes on.
Front or back?
Well, I think I hear them out here. And I think Aiden or Declan had her in the garage, but
I
she's
think
never.
I had her in the garage.
Child struck by a car.
Hi.
Good job. Blaster explosion.
Hi.
Is assault.
Hi.
Mom punched you in the face.
Hi.
High.
Hi. Mom punched you in the ankle.
Hi.
In the ankle.
Yeah, I punch hard.
Low.
I don't
Granny
actually
Joe
know.
hitting your dad in the face. High.
I punch
She
her.
had a lot of rings.
I punch her in the kidneys though.
Okay.
Are we being recorded?
Their voices are.
Yes, your voices
Oh.
are. That's why I showed you guys so she could see that you two were here and you're not just like, I'm not like a puppet or something.
Ventriloquist?
Yes.
I should probably not talk about punching in the kidneys. We're gonna have some domestic violence charges.
Right.
Okay. Okay. What else? So you go on somebody, stabbed in the leg, hit an artery, bleeding,
Hi.
spurting blood.
So
We're not doing that
Oh,
anymore.
we're not doing that?
It's spurting
Like
blood.
it's so high.
You apply pressure and blood is still coming out.
Yeah.
What are we gonna apply?
Tourniquet.
Yes.
Yeah.
Do we go above the wound or below the wound?
Above.
Above the wound.
Everything okay?
Can we take that tourniquet off if we think it stops bleeding?
There's no.
No.
She ran outside.
Talk
Yeah,
them
your
what?
tourniquet stays on until they get to the right. The hospital.
Agreed. And try to
Thank you.
time it, put the time on it so they know approximately how long it's been on.
Even with their own blood.
Yes.
I learned that one.
Good job, good job. What if they're bleeding from their neck?
Well, then you're
Is it
just
that?
in trouble. You just hold pressure on it.
Hold pressure
Oh
on
no,
it.
you should still put a tourniquet on it.
Do not put a tourniquet on their neck.
Come on.
Try to apply a lot of pressure. We have stuff called hemostatic gauze, which has clotting in it.
Factor in it.
Yes. So you can,
Stuff it in there.
yes,
Yeah.
and hope for the best.
Yeah. I wanna do that.
I don't even want to see it done.
You're gonna do it?
No.
Cats.
If I'm knocked
Do you like
out.
the normal creamer or sugarless?
That one.
Okay. I don't know how much you like, so I just brought the
So,
creamer.
high trauma
You just do it.
is on the TV show where Peter's about to get eaten by a mountain lion.
Yes, good job, good job.
Same thing.
It's a puma.
Mountain lion.
Puma.
Okay. Yeah, I went over that.
Okay, here's a question for you right quick.
Yes.
So you get on a call where somebody fell and their leg is sitting on a power cord of some sort. Do you immediately go in and tend to that victim,
Nope.
or do you do something different?
So, BSI, scene is safe. Is my scene safe? If there, are you saying like an electrical power cord that's like sparking?
It doesn't matter if it's sparking or not.
What if they
Well, when
just
I-
landed on an extension cord?
That's what I was
Well,
thinking.
no, I'm like,
Or do you mean like a down power line?
well, not even that. Like, say they're on a catwalk of some kind or whatever, and their legs over on a power line of some
Oh,
kind.
No.
gotcha. So
Yeah.
it doesn't have to be sparking or
No.
anything, but
No, there's still possibility I could get shot.
Exactly.
I important. BSI, scene safe. We'll call fire. Fire will call electrical company. And also, I'm not climbing up anything.
Yeah.
Mm-mm.
Well,
If it involves any type of ladder of sort, that is fire. I'm the transport service.
No, I just wanted to ask because when I did my climb and self rescue for the wind turbines for that little bit, that was something that they pounded in your head is you're more likely gonna be rescuing your colleagues up tower or whatever, like you need to make sure it's safe to get to them, you know, like you have to make sure that they're not putting you in danger. Cause yeah, they could say like they've got their leg and it's up on a power cable or whatever, nothing's happening, wherever you go, as soon as you touch it, you're
Yep.
done.
I'm dead.
Yep.
Cool. I like it.
Okay. It's okay. It's my book. I paid for it.
Oh my god.
Okay. Do you guys know how to make your own tourniquet?
Yeah,
If you don't have one,
yeah.
how?
Well, I will take my bra off and I will wrap it around my leg.
Okay, that's a good option.
A belt would work.
A
The
belt.
belt can work. They're not always the best.
No,
So
but
say-
it's
Sometimes
wide.
Yeah, well, and sometimes the buckle keeps you from getting it really tight too.
So say that you fell out of plane. You're not wearing your bra. You're also wearing a crop top and bikini bottoms.
Why would I not wear a bra on a plane?
Just say
They're
that
just gonna
is-
be flopping around.
Yes.
But I'm wearing a crop top and bikini bottoms.
Yes.
Just
Well,
take
I would
the-
use either one of those.
And you fell into the woods. You can use your crop top and a stick.
yeah, and make a rock.
Yes. Good
Yeah.
job.
I was
Good
gonna
job.
say,
Yeah, I could use
Try
my
to rip
bikini
it
bottoms
out.
too. Depending on where I land, though, you know, if I land in the water, I might use my bikini bottoms because I'll be in the water. Nobody will
Yes.
see my business.
Now we're gonna go on to splints and backboards. So when you guys probably don't know it, that's okay. When we go to a car wreck and they're complaining of neck, back pain, we C-collar them. Do you know what a C-collar is?
Yes.
Yes. So it'll keep your neck from moving and creating more injury than what could already be done. And then we can put you on a backboard.
Yeah.
And then we have these straps that go over you to keep everything from not moving. We don't want you to move. And sometimes you're in our ambulances hit the worst bumps. So if we can keep you from not moving and you're worried
Keep
about,
you from moving.
yes, keep you from moving, that's in the best case.
you know, if you don't have anything to support their neck, as soon as you take and support it, you can't leave it.
We
until
also,
somebody else comes in.
if most people don't carry around tourniquets or C-collars or stuff like that, you can use a towel and wrap the towel around their neck to hold it in place and then tape it. It's called a horse collar. Sometimes we have to use those on people that are a little obese and don't have a neck.
Oh.
And they're just Bob's Burgersing it. Sometimes a C-collar will not work.
Gotcha.
Yes.
Bob's Burgers.
Yes, you know how they don't. Anyways. Okay, splinting. Do you guys know how to splint an arm?
Ish.
Just depends on where you need to split it.
So our splints are moldable. So say my arm needs splinted. We're going to use my healthy arm. We're going to mold it to my healthy arm. And then put it on this one. And then wrap with gauze to keep it in place. Wrap over the knuckles. Do not go over where you bend.
Yeah.
Do not splint over joints, and you want to make sure that CMS is intact. Do we know what CMS is?
Sensitive?
Yes, good job. It's when, can you feel my fingers? Okay, can you squeeze my fingers? Can you feel me tickling you? And then you feel a radial pulse. Make sure they have pulses.
So what
And
happens
then
if
make
they
sure
blow
they
their
have-
elbow out?
Huh?
Yes, an elbow.
Yeah, what happens if you, like, your elbow gets blown out and it's just,
Yeah, you can't split.
Then
an
we
elbow.
just hold it to you,
Yeah.
because we can't splint over joints.
The guy that
Yes.
left his Harley, him blew out his elbow.
Yes. Good. Always check a pulse before and after you splint. It can indicate if it's too tight. We don't want to lose
What if
pulses.
before you splint there's no pulse, but they still have all the movement and stuff?
Then that would mean that they have,
if you're checking the pulse down there, then it's a little bit lower, right? Because then you say that you gotta have like over a 90 to feel it in your wrist.
sorry. It just means that it's, ask the question again.
What
If
if
you- what was the
before you
question?
splint their arm,
Yeah.
and they have all the senses and stuff, but they have no pulse.
Oh, it means vascular damage. It's bad.
Oh.
That means that they messed up something in their veins
Mm-hmm.
or their arteries or something on the inside.
Do you still splint it?
That I don't know. I'm gonna look that up. I would assume so.
Could it also be from them having lower blood pressure though? Not
Yes.
from the pulse?
Yes.
But you would think if they
So yes,
aren't,
still-
they'd have a high one.
Still immobilize it. Still keep a sling there. Don't let it move, because that's worse. Worst
Right.
case scenario. No. I forgot. Okay. So, shock. You brought shock earlier up. We have somebody that's in hypovolemic shock. What do we want to do for them?
What kind of shock?
Hypovolemic.
What's that?
It's you're losing the volume in your body. So that could be water, that could be blood. So
Losing the volume in your body.
yes,
Yep.
the water in your body
Yeah.
or the blood. So people who get their legs chopped off in the army, they're most likely going to be in hypovolemic shock because they're losing too much blood. Or it could be babies who are left in hot cars and then become dehydrated. They could be in hypovolemic shock. Unfed babies, hypovolemic shock. But we're gonna say we go in a car wreck, limbs are all cut off. They're a chicken nugget now, and they're in hypovolemic shock. We already have tourniquets applied. What else can we do for them? And there's no more bleeding. I don't expect you guys to know this.
I was gonna say, you try to give them some fluids, but you'd have to put it on a small, you wouldn't wanna force it to them.
Yeah. Yeah,
Just
I
have
guess
it
I
while
should
you're
have kept an arm or something. Yes, we can give them fluids.
They
In
got a
this,
vein in their neck, right?
yes, in that case, I can't do EJs. Nationally, per our protocols, I can. Statewide, per our hospital, I cannot do EJs.
That's the neck.
Huh?
Is that the neck?
Yes, that's the neck. So I would see if my medic could get an EJ. Or I could say their arms cut off like right here. I might be able to get a humoral head IO, which is where I could drill in their humoral head right here. And then we want to keep them warm. Keep them warm. Because if they're cold,
They feel warm, but they're also not.
but they're not,
They're not circulating vessels.
yes, which is called perfusion.
Profusing.
Yes, good job. Keep them warm. Also, give them some supplemental oxygen. Because if their O's start going down, bad news. Now we got more problems. So throw them on a simple mask at like 2 liters. But if their oxygen's bad, throw them on non-air breather, 10 to 15. If they're only breathing like 8 times a minute and no air is going in, breathe for them. Badly. 10 to 15. Beautiful, beautiful. Beautiful. We have not much longer. You guys are doing good. You guys are doing great.
Question.
No.
Answer.
If it's colder outside, is your... How do I want to ask this? I'm not sure how to really ask it. Is your cold weather better for injuries compared to hot weather?
No and yes.
Not so much as, becoming, hyperthermic or anything like that.
Yeah.
But
It really just depends. So, like, one of the big things that I think of when it comes to, like, cold versus hot is, so we have warm water drownings. So if they're in there for 30 minutes and it's warm water, it's in the summer and they were in the water, or it's in the ocean and it's in the summer, you're not going to want to work them. They're past the point of CPR. Now say it's freezing cold out and they're drowning in the water and they've been in there for 30 minutes, we're going to work them because they have a higher likelihood of surviving from that because their body, your heart rate can go down so low in cold weather. What, baby?
I'm gonna ask you a secret.
Yes, if Mimi said yes.
no, the only reason I asked that is because somebody was telling me
You
the
wanna
other
watch
day
it
that everybody complains that it's cold in operating rooms. is
Well, I'm
because
gonna stay out here because I'm
when your
helping mommy.
body's a
Do
little
you want to
bit
sit with me?
colder,
Yeah,
your body's
you're
more
less
sensitive,
likely to have it.
like major bleeding or something like that. 'Cause-
Yeah.
And I didn't know how true it was, but I kind of wondered.
Yes. Okay. You're doing so good, Dad. I'm so proud of you. You sure you don't want to become an EMT?
Nah, I couldn't handle it. I can handle more of what I could when I was younger.
Okay. Now we're gonna go over injuries. I already told Mom what a hematoma was. It's where the blood vessels are damaged, so
No.
it creates
No, you gotta keep it in here.
like a bruise. And sometimes they won't bleed. Old people, they tend to bleed more. And I don't know if you've seen like with Grandma Cora, those injuries on her arms when she falls and it looks like a pocket of blood's just stuck under there. Her skin is so frail, so if she were to skin tear, it'd bleed a lot. But if that were to happen to you or Mom or Aiden, it would be a bruise on us. Grandma's bruises are going to be a lot more severe because of how old she is, how much elasticity is gone in her skin, so on and so forth. Okay, so let's go to contusion. So a contusion is, it's kind of hard, but it's like a bruise, but it doesn't break the skin. So exactly what I just said with a hematoma.
So is it like a blood blister then?
Kind of, yeah. And hematomas will most of the time like come out. So like if you have somebody with a goose egg on their head, that's a hematoma. But if you were to have a bruise contusion, and then that black and blue discoloration under the skin, the bruise, that's called ecchymosis. So yes, what's another one? Do you know what crush syndrome is?
Crushed?
Crush syndrome.
Like when a building collapses on you.
Guess not. No.
So crush injuries, good job. So
Oh, okay.
like people. You got
So would that be
weirdo
something
outside.
like our driver at work where the latch of the dump truck got his finger?
No, so crush injuries. So say my arm is in under something heavy and then it falls and it squishes it, crushes it. Crush syndrome is when there's tissue necrosis develops like immediately and then it releases really harmful things into your body.
Mm-hmm.
And sometimes with crush injuries we'll see
I don't know. Maybe
what is it called?
That's where you gotta be careful taking the weight off of it or whatever. 'Cause
Yes.
it'll rush. Okay.
Because it can rush all of those chemicals down to your heart. Crush injuries, very, very scary. Blood flow is returned almost instantaneously, freeing the limb, but it can cause substantial amounts of potassium to suddenly return to the heart circulation, which can cause renal failure, hyperkalemia, rhabdomyolysis.
Whoa.
Yes, rhabdo, degradation of dead muscle tissues. So right when you, because we can't leave them there. We can't just leave their limb under there. And we also we can't just cut it off. We're not allowed to do that. So we need to get IV access, airway access. So throw them on some oxygen, get IV access to wherever you can before they are freed. That way that you can try to. So the solution to pollution is dilution.
Makes
So
sense.
yes, when you have potassium invading, you can dilute it to get it away. Solution to pollution, dilution. Same with overdoses. Solution to pollution, dilution. Yes. Okay, you guys are doing great. Do you know what compartment syndrome is? I feel like you would. I feel like you have compartment syndrome.
Compartment syndrome.
Yes.
I want to know.
Does your tummy hurt ever?
From what?
From your surgeries?
No.
So it's like
now, I
closed.
used to have ghost pains.
Yeah, that could be like compartment syndrome. It's where that protective layer of skin is damaged, and it can cause pain out of the proportion of the injury. So
I was gonna say about the only pain that I have down there every once in a while is from the hernias.
yes. Do you know what an abrasion is?
That's great.
Yeah, it's great.
Yeah,
And
yeah.
scratch.
So, track burn. Track burn's a really good abrasion. Road burn, abrasion. Do we know what an avulsion is? Avulsion. So I had it last week when I wrecked the dirt bike.
It's too big
The
for a
skin
cast
flap
iron.
came up. So it's where the first layer of skin is taken off, but not completely. And you have to put it back in place and wrap it for it to heal correctly if you want that skin to stand, like, to look better. So, like, I didn't do that, so now I'm gonna miss a portion of this tattoo out of my fucking arm.
Oh,
Freaking arm.
do you know what degloving is?
That's a good one.
It's where your meat and everything comes off your finger or whatever.
It's pretty nasty. I would love to see it.
What do they call it when your IV comes out, but it's still pumping into you?
You know, it's not in the vein, it's just under the skin.
Oh, when you're getting fluids into your skin and not into your vein.
Mm-hmm.
It's not. What we call it is we blew the IV. We will take it out, but sometimes, like especially in like the nursing setting, they go get that IV. Call light dings. They go to that call light. They forget, and they didn't aspirate. So, a very good thing that we do as EMTs and medics and all the things that can do IVs is you aspirate to make sure that you're in that vein. Because if you try to aspirate and you don't get blood in your chamber, you're not in the vein.
No, I'm talking after the fact.
After the fact,
like it
there's
just
not.
slips out.
Yeah, it's just called you went like I don't know what it would be called,
Because
but
I've had
it's
that happen.
yes, it's just saline under the skin. If that were so, we carry D10, D50, that's sugar water. If that were to happen, that's not good. That can cause necrosis of the skin. I do not know, however, how to fix that.
I was gonna say when mine happened or whatever, I was getting lactating ringers or whatever, and she thought I should have been in a tremendous amount of pain or whatever, and it itched. And when I looked down there, I told her,
Yeah.
we got an issue.
Yeah,
She comes
probably.
over and pulls it right out of her. My forearm was the size of a football.
Yeah, that's insane.
And so she's like, I can't remember if I kept it wrapped or
Yeah.
what.
You had to wrap it.
Yeah.
And
Yeah.
then she said, nope, your body will just slowly absorb it or whatever.
Yeah, and it
so then we
will.
never did a pump after that. We just let it free flow.
But sugar water can eat the skin away. It's very necrotic. So,
You want to go swimming
okay.
tomorrow?
Do you know what laceration is?
Okay.
Like this.
Smooth or jagged cut caused by a sharp object or blunt force. I told you avulsion. What does amputation mean?
It cut off.
It's gone.
Yes. Cut off. It's when we think of amputations, we think of extremities,
Sammy.
but it can also involve the nose, the ear, the fingers, phalanges.
Phalanges?
Yes.
Are your toes phalanges?
Yes.
Okay.
Good job. Okay. We have somebody that was bit by a dog. They're bleeding a little bit. What are we most worried for? If bleeding's controlled.
Infection.
Rabies.
Yes. Rabies could be one, yes. But mostly infection. Dogs' mouths are nasty. Most pet owners don't wash their dog's mouth. I don't. Do you? Brush your dog's
Never
teeth
have,
or
no.
something? No. Sometimes I get them the bones that like is supposed to clean their mouth. But yeah, we're worried about infection, so they need to be transported immediately, and they could be put on certain antibiotics that can fight that infection before it comes. And then we can decontaminate the wound on scene too. So our saline flushes, flush it out, clean it off. Good job. How are you doing?
I'm doing great.
Okay,
I'm
good.
great.
He needs an amputation.
No, not yet.
Ooh. Dad, do you know what an evisceration is? I think you had it, when, your guts hang out.
Oh, I wasn't awake.
No, but you had a surgical evisceration.
I have no idea. You
Mom
have to
took
ask your mom.
pictures.
Yeah, but were they laying outside my body?
Were
or-
they? No, lame.
Yeah.
No, they were inside.
But
So,
yes, it's when your
I've got
organs.
Come
a
out.
buddy
Yes.
whose boy was born that way, where his intestines were outside of his body and they put everything in,
Yeah,
and he's living
normal now.
normal life
Yeah.
for the most part.
You can. Those things are very easy to take. Not easy, but they're treatable when you're a baby. They see that not a lot, but more than eviscerations that happen out on the street. Like, with eviscerations, keep it in. Don't let them let go. Hold it there. Put some sterile dressings on it to keep it there. If for some reason it falls out, get a bag. I don't know. Hold them in there.
Don't let them drag on the ground.
Yes.
Alright.
Air embolism.
There's air in your bloodstream.
Yes. So, it's a block of the blood flow to the heart, to the brain. People all the time, you'll see it. Is that too much air? Is that gonna hit my heart if they don't? I've seen it with medics where,
Yeah,
There'll
they
be
don't
some-
bleed
they won't leak it all out and those little bubbles that are in there and the patient gets worried. You're not gonna have an air embolism from that. It takes, about 50 mLs in a syringe, pushing all that air in to cause an air embolism.
Which is like half a cc, right?
Huh?
Isn't that
50 cc's.
Oh, 50 cc.
Yeah,
Yes.
I was gonna say,
To cause an air
I was
embolism.
gonna say, like, you could almost, like a normal,
One normal syringe is 1 cc.
well, no, like a normal, just length of
A normal
IV
syringe is
tubing
10
or whatever,
cc's.
like, I'm pretty sure you could do that whole tubing and be fine.
Is
They
it
don't ever
100
do it,
units
but-
a cc?
You're really asking me math in front of my teacher, man.
I'm sorry.
I don't know.
And I could be wrong on that
Either.
tubing too.
In the cupboard where the spices are, there's a syringe. Will you grab it, please?
Syringe.
Yeah, 10 cc's, 10 mLs in a typical saline flush syringe. I was right.
Oh, that's a big syringe though, isn't it? Like
It's
not,
our normal saline.
Yeah,
But I mean,
so, yeah.
but it's not like a normal like dietetic syringe.
No,
No.
no. She's talking a
That's-
syringe like what I was using when I was doing my IV flushes.
Yes,
For
not
a
that.
Yeah, because like this is
Or
20 units, so it's like isn't there 100 units in 1 cc? Or is that wrong?
There is 100 units.
Okay.
Good job. Good job.
Okay.
Anyways, but we don't want our patient to have anxiety from those air bubbles, so always
Right.
keep it. You want your line to get patent. So sometimes if I'm in a rush and I filled the bag of fluids and then I see a bunch of air bubbles, I'll just pop the cap off and let it leak down a little
the
bit
floor.
until they're all gone.
Yeah.
And then I'll lock it for my medic and then they can hook it up. And then my medic's done that for me on my first clinical. She let it
Mhm.
flow and then locked it for me.
Heck yeah.
Air embolism, avulsion.
What about a fatty embolism?
Did that pause on you?
No, it just said dying battery. But it's fine. We only need like 5 more minutes. You guys are so great. Okay, do we know what gangrene is?
It's an infection.
Dead tissue.
Yeah.
Yes, yes.
Yeah.
That can cause from infection. So It's
Treating
when-
injury or whatever.
yes, yes. And
Wow,
I've seen someone that let their appendix burst, and he was a farmer, so most of the time farmers will not call 911. Sometimes they don't even come to the hospital. Their maple syrup is their medicine.
Yeah.
Anyways, he was like, "Yeah, my stomach hurts. It's like a 1 out of 10," and I was like, "Oh, okay. You just got the flu." And we get there, he was vitally stable for some reason, but he was gangrene from an appendix rupture that happened a while ago, which is insane. If your appendix ruptures, you're like,
You're
most of the
doubled
time it's
over
10
pain.
out of 10 pain, doubled over. Could be a huge medical emergency. or maybe it was his gallbladder. Something ruptured, bad gangrene. So yes, good job, good job.
I'm gonna say
Did
that-
he die?
No.
Gangrene
say
in his
that.
abdomen?
Yeah, surprisingly, but we have a
say that
great
farmers
hospital.
are a different breed.
Yeah, they're tough.
Farmers are a different breed. Tetanus. What is tetanus?
I don't know.
It's
It never
it's
hurts
something that makes your muscles and stuff spasm and tense up.
That's
right?
yeah, that's what can those are symptoms after you
After you
get
have it?
tetanus.
Yeah.
It's an anaerobic bacterium infection.
Okay.
So rust can cause it.
Yep.
Nasty dogs who bite you can cause it.
Really?
Yes.
I didn't know. I knew rust, like rusty
Yeah.
nails and dirty thing, like
It
even dirty glass from windows. I didn't know dog
Yes.
bites.
it can produce like very old dogs. It can produce very strong, potent toxins, which can cause larynx spasms, muscle spasm, and then result in death. So
How do you know if you have it?
you can get tested for it. But if you're at the point of muscle spasms and laryngeal spasms, I can't say it right.
Larynx stuff.
Bad.
There's a-
But it can take over. It can take. So I went and got my tetanus shot after the dirtbag wreck. I would have been fine, but I got it because I was scared. But I've already had a tetanus shot within the past 10 years. Say I didn't have it though, it could have developed in 24 hours. But it's always good to get a booster in case it's been, if you're like, oh, I think it's been 10 years, but it's actually been like 17 years.
'Cause
What if
we've
it's
had
under
ours.
5?
Well, 'cause we've had
You
ours
can
when
talk-
we had Declan.
Yeah. You can talk to
Oh,
your
yeah,
primary
more women.
and figure out what they think, if they think you should get your tetanus shot after something like that happens. Do we know what fasciitis is?
It's in your foot, honey. Is it a
Oh,
pain?
plantar fasciitis, like
Oh, yeah. Inflammation of the fascia. So yes, it's skin tissue that's
Skin
inflamed.
tissue.
Do we know what necrotizing fasciitis is?
It's when your skin is dying.
Yes. We see it a lot in people with bed sores.
Necrosis.
People who lay in a hospital bed or a nursing home bed for long periods of time, or people that have been in, I've seen it, where they get in a really bad car wreck, high velocity trauma, they get some type of injury on their body, and then they can't afford a nursing home. They can't afford all the time care, so they sit at home and it gets rotten. Necrotizing fasciitis.
so would
Flesh
mom
eating.
No.
have on that one spot on her side that never would heal, or is it just from all the chemo and everything?
I don't know. It wasn't
Chemo-
necrotizing, though.
Chemo, you're at very, 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 very high risk of infection. It causes your immune system to take a shit.
Well, no, I
So,
know that.
yeah.
But hers
You
just
know,
went
Granny
it was
Joe,
like an
she
open
would-
wound all the
Yes,
time.
and
But it
that's
wasn't
because
necrotizing though.
it
It wasn't dying tissue and
was-
stuff. It was
One of her spots that was radiated or whatever, and
Yeah,
it
there-
wouldn't heal.
so
yeah, it
was
would
like,
take her a lot longer to
yeah, it
heal
was a radiation
anything.
burn that
It
would be
wouldn't
healing.
heal.
Yeah, and that's
They
because of the
probably wouldn't.
chemo and her long life of chemotherapy.
Right.
Okay. We went over amputation. I told you penetrating wounds. We can do that if we can't tourniquet them. We can pack them if they're bleeding heavily, like a neck. Try to find your entrance and exit wound for a gunshot wound. Open neck wounds are so close to the carotid arteries, so say it doesn't involve any type of gun. Say, car wreck, they somehow got a cut on their neck. It's so close to the brain and so close to the carotids, we want to clean it very fast. We don't want that to get infected. Infection can lead to the brain, which could lead to death. Pathophysiology. Burns. How can we treat a burn? Do we know? Anybody know?
Depends, I
With
guess, on
fire.
the stage of it or whatever, but
Fire.
So if you went on a patient who was burned, you would put fire on it?
Yeah.
No.
Just kidding.
it just depends on what stage of the burn it is, I guess. 'Cause
Yes.
It's like if it's 3rd degree or whatever, you don't want to put anything on it.
Yes, we don't want to put cold on it. Cold can send them into shock. Sometimes, if you have a chemical burn, if you try to, because we want to clean the burns with saline.
Right.
If it's a chemical burn, you can make it worse. So
Right.
always call. We have our
Well, you gotta figure out what chemical they were messing with.
yes, and if you can't, you call your medical director and say, "What do I do?" And they can give you a good idea. They have a lot more knowledge in those. Always look for how bad the burn depth is. If it's partial thickness burns, superficial burns, full thickness burns, full thickness all over the body, partial half of the body, superficial on top of the layer of the skin. Good job. Can cause hypovolemic shock because burns take away all of your fluid, all of that volume in your body. So always treat with fluids, and instead of treating with normal saline, we treat with LR, which is electrolytes.
Lactated ringers.
Yes, lactated ringers. Good job.
Is a CC and an LL the same thing?
I don't know. For burns, we go over the rule of nines. So for an adult, 9, 9, 9, 18, 18, 18. 1 for your genitalia, back 18. For a child, 18, 16, 16, 18, 12. And then for peds, 18, 13, 13, 9, 9, 1. 18. Because their heads are so big. That didn't make sense, but I had to say it. Whew! Doing good, you guys. 5 more minutes.
You said that 5 minutes ago.
Okay, you're right. This chapter is just giant. Okay, so we went over trauma. You guys did great. In conclusion, trauma is the bread and butter of EMS. There's so many different types of traumas, so many different ways to take care of traumas, and if we know traumas and know how to treat them, our patients are in luck. Do you guys have any questions?
No.
I think Molly went outside with my phone.
Okay. You want me to grab the phone or?
Yeah, tell her if she's gonna be outside with the boys, my phone has to be in here. She can put her that with it.
Do we have any questions about trauma? Any things that you guys think I could do better or that I did good at?
You did very good at everything.
Do you feel like you've learned?
Yeah.
Do you feel like I understand trauma?
Yeah.
Dad,
Necrotizing fasciitis.
you guys think I'm okay?
How you're doing good, sweetie.
There's so much. It would be like 6 hours long if I went over in everything. There's so much to trauma, but big things: X, A, B, C's. Treat the bleeding. Treat the airway. Give them fluids. Keep them warm. Give them some oxygen. Drive fast.
Just do what you can if you don't have it.
Exactly.